Imagine a magnificent racehorse, just a blur of muscle and speed thundering down the track. It's an almost impossible feat of athleticism, really pushing the very limits of what a living creature can do. But what if, beneath that incredible display, there's a hidden, silent challenge? Our deep dive today isn't just about a medical condition. It's about understanding the silent battle within these magnificent athletes and how this hidden challenge fundamentally reshapes our approach to elite equine performance and, well, welfare. We're diving deep into exercise-induced pulmonary hemorrhage, or EIPH, in horses. You often hear it called bleeding, colloquially. This is a remarkable look at extreme physiology pushed to its absolute limits, revealing a condition far more common and complex than many realize.
Yeah, and what truly strikes me about this condition is just how prevalent it is, yet, like you said, how often it goes completely unnoticed by the casual observer. We're really talking about a significant and widespread issue in high-intensity equine sports. And, while the term bleeder might immediately make you think of an obvious nosebleed, what we veterinarians call epistaxis, that's actually a common misconception. Only a small percentage, maybe roughly 5 to 10% of horses with EIPH ever show external nasal bleeding. So in the vast majority of cases, it's a silent condition, and that makes its diagnosis and management particularly challenging.
That silent aspect is truly eye-opening. So does that imply we're likely vastly underestimating how common this is, maybe even outside of racing where horses aren't scoped quite as often?
You're absolutely right. That silent nature means many horses with EIPH, especially, with lower grades, grade 1 say, are still performing at very high levels without any obvious outward signs. It really underscores the critical need for, well, objective diagnostic screening, because you wouldn't necessarily know what's happening just by watching them race or train.
Mhm.
And just to elaborate on that definition, EIPH is precisely the presence of blood in the airways of horses during or immediately following strenuous exercise. It's essentially a hallmark of these high-performance equine athletes.
And when you dive into the numbers, the scale of this problem is genuinely astonishing. Are we really talking about endoscopic evidence of EIPH in, what, half to all thoroughbred and standardbred racehorses after a race? That's practically ubiquitous?
It absolutely is. That range, 50 to 100%, it really highlights how integral EIPH is to the physiology of intense equine exercise. It's just part of the picture at that level. And it's not just racehorses either. We see it in other athletic horses too, like barrel racers, polo ponies, eventers, show jumpers, although usually it's at a lower severity compared to the racehorses. What's also pretty clear from the research is that both the incidence and the severity of EIPH often increase with the horse's age and the number of race starts they have, which strongly suggests a kind of cumulative damage to the lungs over their competitive career.
It really paints a picture of just how much these equine superstars are pushing their physical limits, doesn't it? Almost like a cost of doing business at that elite level. Okay, so now let's get into the mechanics of it. You might be wondering, how does this bleeding actually happen inside the horse's lungs? You mentioned the stress failure hypothesis. That's the leading theory.
Yes, that's the most widely accepted theory. And if we step back and look at the bigger picture, it's a testament to the sheer physical demands placed on these animals. They're pushing their physiology to the absolute limit. It's basically a case of the body being pushed beyond its structural capacity. So during intense exercise, a horse's cardiac output, that's the amount of blood pumped by the heart per minute, can increase dramatically. We're talking maybe up to 8 times the resting rate.
Yeah.
This creates just an immense surge of blood flow through the pulmonary circulation, the system carrying blood to and from the lungs.
Okay, so an 8-fold increase. That's a massive volume of blood suddenly rushing into the lungs. It must create a kind of superhighway traffic jam in there.
Precisely. That's a good way to put it. And that surge leads to soaring pulmonary vascular pressures. The pressure in the pulmonary artery, for example, can hit incredibly high levels, sometimes exceeding 100, maybe even 120 millimillimeters at peak exercise. And critically, the pressures on the other side, the pulmonary venous and left atrial pressures, they also elevate significantly, maybe up to 60 or 70 millimilliHg. So this creates a kind of back pressure in the system, almost like water building up behind a dam.
Wow, okay. So with all that pressure building up, both coming in and trying to get out, what happens to the tiny capillaries where the gas exchange actually happens? They must be under incredible strain.
They absolutely are. The pulmonary capillary transmural pressures, that's the pressure across the wall of the capillary itself, they get caught between these high arterial and venous pressures. And they can reach exceptionally high levels. The estimates are maybe 70 to 100 millimilliHg across that thin wall. Now, consider how delicate those capillary walls are. The alveolar capillary membrane in the lungs is unbelievably thin. We're talking fractions of a micrometer thick. maybe zero point 0.2 to zero point 0.5 milliliters. So it makes them highly, highly susceptible to rupture when those internal pressures exceed their mechanical strength.
It's honestly a miracle they don't burst more often with those kinds of forces. Is there anything else adding to that stress, like the breathing itself?
There is, yeah. There's an added stressor from negative alveolar pressure. During forced inspiration, like when a horse is galloping absolutely flat out, they generate these exaggerated negative intrathoracic pressures, big deep breaths. This creates high shear forces. Think of it as kind of tearing or stretching motion across those already stressed, delicate capillary walls. It further strains them. So it's the combination of these extremely high intravascular pressures and the significant negative alveolar pressures that causes microscopic ruptures in those delicate capillary walls. And this allows red blood cells to extravasate or, leak out into the alveolar spaces, the air sacs, and then eventually into the airways. And that's the bleeding we ultimately see.
So it's really a complex physiological puzzle then, multiple pieces contributing to the overall picture of EIPH. And it sounds like it's not just about the intensity of the exercise itself. Are there other factors that can maybe worsen it or predispose a horse?
Yes, absolutely. While that stress failure is the core mechanism, other factors can definitely contribute or exacerbate EIPH. Things like chronic inflammatory airway disease, you might hear it called IAD or RAO, that can play a role. Even subtle cardiac dysfunction like mitral valve regurgitation might contribute. It's also interesting to note that researchers consistently observe the EIPH lesions being more severe in the dorsicaudal lung fields, that's the top back part of the lungs. This possibly happens because of a preferential blood flow redistribution to these areas during intense exercise.
Right.
So yeah, it's truly multifactorial.
Right. Okay, so given that most horses, as you said, don't show an obvious nosebleed, how do veterinarians actually diagnose EIPH and, importantly, assess its severity? What are the subtle clues they look for?
Often, the most common yet subtle clinical sign you might actually observe is, well, poor performance. Maybe horses don't finish races strongly. Trainers might say they're stalking or tying up, though that term can mean other things too. They might show increased recovery time after exercise, maybe have reduced competitive drive, or just fail to progress in training as you'd expect. Occasionally, you might notice a cough or maybe some excessive swallowing after exercise, but honestly, these are less common signs.
That raises a really crucial point, though. If a horse does have a nosebleed, epistaxis, even a small one, how do you know for sure it's EIPH, not something else? Something potentially more serious?
That's an excellent question and clinically very important. Before jumping to an EIPH diagnosis based on epistaxis alone, it's absolutely crucial to rule out other serious conditions first. These include things like guttural pouch mycosis, which is a very severe, potentially fatal fungal infection, or ethmoid hematoma, that's a progressive non-cancerous mass in the nasal passages, or even just direct trauma. You always start by ruling out the most dangerous possibilities. But for diagnosing EIPH itself, the gold standard for immediate post-exercise diagnosis is tracheobronchoscopy, or, simply endoscopy. This involves passing a flexible endoscope down into the horse's trachea and main bronchi, typically done 30 to 90 minutes after strenuous activity.
Okay, and that's where the EIPH grading system comes in, right? To quantify what the scope sees.
Yeah, exactly. There's a standardized EIPH grading system. It runs from grade 0, which means no blood observed at all the way up to grade 4. Grade 4 signifies a large amount of blood covering most of the tracheal surface, and often these horses will have visible epistaxis as well. Grades 1, 2, and 3 represent increasing amounts in between. Now, while endoscopy is very helpful, really the go-to, its sensitivity can vary. It means some deeper hemorrhage further down in the lungs might actually be missed. It's really just a snapshot of the immediate aftermath in the large airways.
So if endoscopy is a snapshot, what if you suspect maybe deeper bleeding, or perhaps you miss that immediate 30 to 90-minute window for scoping? Is there a way to look for, I think you mentioned, the footprints of past bleeding events?
That's precisely where bronchoalveolar lavage, or BAL fluid cytology, comes in. It's a really powerful tool for quantifying hemorrhage deeper in the lung. It's especially useful if endoscopy is negative or maybe equivocal, or if the assessment is delayed by several days post-exercise. And what's truly remarkable here, like you said, is that we can see the footprints of past bleeding events, even long after the fresh blood itself is cleared. It gives us a unique window into the horse's bleeding history.
How do you do that? What exactly are you looking for in that BL fluid sample?
Right, so with BAL analysis, we look at a few key things. First, there's the simple red blood cell, or RBC, count that quantifies acute hemorrhage and is detectable for several hours, maybe up to a few days post-bleeding. But even more uniquely, we look for hemosiderin-laden macrophages, often called hemosiderophages. Think of these as the body's cleanup true specific immune cells, macrophages, that have basically eaten the escape red blood cells and broken down their hemoglobin into hemosiderin, which is an iron pigment. Crucially, the presence and number of these cells indicate past bleeding episodes, and they can be detected for weeks, even months, after a single EIPH event. There's even a semi-quantitative scoring system, the total hemosiderin score, or THS. A score of, say, 75 or higher on a 0 to 400 scale is generally considered indicative of chronic EIPH activity. And just to briefly mention, other diagnostics like chest x-rays or ultrasound are rarely used for routine EIPH diagnosis, but can be helpful to rule out other lung problems. Blood work is usually unremarkable unless there's been massive blood loss, which is rare.
Okay, given all this, it really sounds like there's no definitive cure for EIPH, is there? So how is it managed? What's the focus of treatment, really?
You're right, there's no singular cure available. Instead, management really focuses on reducing the severity of the bleeding episodes, mitigating the consequences of that bleeding, and ultimately optimizing the horse's performance and welfare. Now, the most effective and scientifically proven pharmacological agent we have for reducing EIPH severity is a drug called furosemide, which most people know by the trade name Lasix.
Ah, Lasix, right. That's the one you hear about a lot, especially in racing.
Exactly. And if we consider the broader implications, this drug really highlights the complex ethical and performance considerations within elite equine sports, because an effective treatment is also a regulated substance. Furosemide is a potent loop diuretic. It's typically administered intravenously, usually about 4 hours prior to exercise or racing. Its main action is to reduce the horse's plasma volume, typically by about 8 to 10%. And by doing that, it effectively lowers those critical pulmonary artery, venous, and capillary pressures we talked about earlier, the ones causing the rupture. It's been pretty consistently shown to reduce EIPH severity by approximately 90% in thoroughbreds running at racing speeds. So, quite effective.
A 90% reduction is,
Okay.
that's huge. But you mentioned controversy. What's the core of that debate surrounding Lasix?
Well, the controversy really stems from its dual effect. Furosemide not only reduces bleeding, but it also appears to improve performance. Now, the exact mechanism for that performance enhancement, separate from just reducing the negative effects of bleeding, is still debated. Is it weight loss from fluid? Is it some other metabolic effect? But because of this dual nature, treating a condition and potentially enhancing performance, it makes it highly controversial in terms of fair competition and the integrity of the sport. That's why it's banned on race day in some major racing jurisdictions globally, like in Europe and parts of Australia, but it is permitted in most North American racing jurisdictions, often under specific regulations. This difference in rules creates real challenges for horses competing internationally and for the vets and trainers managing them. And of course, there are potential side effects like dehydration and electrolyte imbalances that need careful management.
So it's definitely effective, but the regulatory landscape is incredibly complex, and there are management considerations. Beyond medications like furosemide, are there any mechanical or non-drug options available that people use?
Absolutely. There are mechanical options, probably the most well-known being nasal dilator strips. You often see them marketed as Filaire equine nasal strips. These are a non-drug alternative. They work by mechanically sticking to the outside of the nasal passages and physically pulling them open wider. This reduces the resistance the horse experiences when breathing in through the upper airways, lessening the overall work of breathing. The theory is that this may help reduce those extreme negative intra-alveolar pressures during inspiration we discussed, thereby reducing the stress on the capillaries. Studies suggest these strips can reduce EIPH severity by maybe 40 to 50% when used alone, and interestingly, they can even have an additive effect when used with furosemide. Plus, they're generally permitted in most equine sports, which makes them a popular and much less controversial option for management.
Okay, that makes sense. Beyond those specific treatments, what about broader non-pharmacological strategies or just general supportive care? What else is important?
Oh, those are absolutely vital for long-term management. You can't just rely on a drug or a strip. After a significant EIPH episode, say grade 2 or higher, giving the horse adequate rest, maybe 2 to 4 weeks of stall rest or very light work, is often recommended to allow that lung tissue time to heal. Environmental management is also crucial, primarily focused on reducing airway inflammation. This means things like minimizing dust in the stable, using dust-free bedding, maybe soaking hay or feeding haylage using pelleted or cubed feed. Good ventilation is key. You also want to avoid respiratory irritants like ammonia buildup from urine or mold spores, and very importantly, managing any underlying conditions, particularly things like inflammatory airway disease or RAO, is critical. This might involve using appropriate medications like bronchodilators or sometimes corticosteroids under veterinary guidance, of course. Training adjustments can also play a role, things like gradual conditioning, avoiding overexertion, especially in young horses, maybe considering interval training, trying to avoid racing in very cold conditions, which can irritate airways, and even the track surface might have some impact. Things like omega-3 fatty acid supplementation are sometimes used for their potential anti-inflammatory properties, but honestly, strong scientific evidence for a direct EIPH reduction effect is still pretty limited. And it's also important to be cautious about, novel or experimental therapies, things like regenerative medicine approaches, hyperbaric oxygen, or certain herbal remedies like yin and payao are sometimes promoted, but they often lack robust scientific validation for EIPH specifically.
Right. Stick to the proven methods and good basic management. So, looking at the long-term outlook, EIPH isn't generally life-threatening on its own, it sounds like, but it seems clear it can significantly impact an athletic horse's performance and overall welfare. Once a horse experiences EIPH, what's the typical prognosis? Are they just destined to bleed again?
That's generally the case, yes. Once a horse experiences EIPH, particularly moderate to severe grades, it is highly likely to bleed again with continued strenuous exercise at a similar intensity. This means it's usually a persistent, chronic challenge for performance horses. Now, while very low-grade EIPH, say grade 0-1 on endoscopy, may have minimal or perhaps no discernible impact on performance, moderate EIPH, like grades 2-3, is pretty consistently associated with reduced performance. You might see them finishing further back in races, earning less prize money, things like that. And severe EIPH, grade 4, especially if it involves overt epistaxis, the nosebleed, is strongly associated with significant performance reduction and often leads to a shorter competitive career duration.
Okay, so that brings up a really important question for owners and trainers then. How do you manage a chronic, progressive condition like this in an elite athlete while still striving for peak performance, but without causing further damage or compromising welfare?
That really is the fundamental challenge, isn't it? It's a constant balancing act. We know that repeated EIPH episodes can lead to progressive changes in the lung, like pulmonary fibrosis, which is scarring, and vascular remodeling changes in the blood vessels themselves. These chronic changes may further exacerbate future bleeding episodes and potentially permanently affect the horse's lung function over time. Therefore, consistent monitoring is absolutely critical. Regular post-exercise endoscopic evaluations, maybe every few races, or after particularly high-intensity workouts, are often recommended for horses in strenuous training, especially those with a known history of EIPH. This kind of monitoring is crucial for guiding management decisions, like adjusting medication, changing training intensity, or deciding if the horse needs more rest. And of course, vigilant clinical observation by the owners and trainers, looking for those subtle signs of poor performance, maybe changes in breathing or recovery, is also incredibly important. It requires a really proactive and adaptive approach to management.
So, what does this all mean for you, the listener, and for the wider world of equine sports? Our deep dive today really reveals that EIPH is far more than just a medical diagnosis. It's a profound statement on the delicate balance between pushing for peak performance and respecting physiological limits. It's a common, often silent, and incredibly complex physiological consequence of extreme exercise in these amazing equine athletes. And while there's no singular cure, it seems a combination of scientifically proven pharmacological interventions like furosemide, mechanical aids like nasal strips, and really comprehensive supportive care things like environmental control, managing underlying airway issues, and careful training adjustments are crucial for mitigating its impact, and ultimately for ensuring these incredible animals can continue to perform at their best, hopefully with their long-term health in mind.
Exactly. And perhaps a final thought for you to consider. Understanding EIPH isn't just about identifying blood in the airways. It's really about appreciating the incredible physiological limits these animals push themselves to. And it highlights the ongoing, often invisible challenge of balancing that quest for peak athletic performance with their long-term health and welfare. It truly makes you wonder, doesn't it? What other silent physiological battles are high-performance athletes, whether they're human or animal, facing as they strive for excellence? And maybe what can we learn from conditions like EIPH about the true cost and perhaps the limits of pushing beyond the ordinary?